Hello everyone. Today we'll continue from the episode previous episodes, that is from the question number 18. Okay, question number 18. An old epileptic patient presented with a complaint of pain in both temporal regions and inability to close her mouth. And after episode 2 fit, the patient has similar problem 3 times in the past. Which of the following would be confirmatory for definite diagnosis? Option number A is history. Option B, blood and urine examination. Option C, X-ray and CT scan. And option D, ultrasound. Here the correct answer will be option number C, that is X-ray and CT scan. Why? See the question. Old epileptic patient complain in pain in both temporal region, both side temporal region, along with inability to close her mouth, that is temporomandibular joint dysfunction occurs. Okay, so here you will have a in X-ray you will see there will be TMJ or temporomandibular joint dislocation. Okay, temporomandibular joint dislocation. Which is confirmed radiologically, and in X-ray and or CT provides better visualization of the joint position. Okay, next we'll go to the next question. That is question number 19. An old epileptic patient presented with complaint of pain in both temporal region and inability to close her mouth. Same after the fit. The patient had similar problem 3 times in the past. 3 times. The treatment of choice. What will be the treatment of choice in this case? First, you have the confirmatory diagnosis, that is the X-ray and CT scan, that is the TMJ dislocation. Now in case of TMJ dislocation, what will be the confirmatory diagnosis? At first is the close reduction and POP or plaster of cast. Option B, close reduction and bandage. Option C, open reduction and internal fixation. And option D, arthroplasty of the TM joint. So what will be the answer? Question number 19. The answer will be option D, arthroplasty of TM joint. Okay, why this will be the answer? Because in case of 3 times, okay, it is so this occurs 3 times, that means there is recurrent dislocation. In case of recurrent dislocation, it often requires the surgical intervention. Okay. In surgical intervention, there is the arthroplasty, which is considered is a conservative management failed. Okay, so we go to the next question. So this will be the answer. Next question is question number 20. All of the following are problems produced by multiple hereditary osteochondromatrosis. All of the following are problems produced by multiple hereditary osteochondromatrosis. What will be the answer? In osteochondromatrosis, you will see multiple bony swelling, deformities and dwarfism. All are okay. So the answer will be the option D, jaundice and anemia. So question number 20, answer will be D, jaundice and anemia. Why? In osteochondromatrosis, which causes what? Which causes multiple bony swelling, deformities and short stature or dwarfism. Okay, next question is question number 21. The fascia, which is generally not involved in droopy tent contracture. Fascia generally not involved in droopy tent contracture. The options are the clearance ligament, option B, Grayson's ligament, option C, spiral band, and option D, all of the above. In this case, the answer will be all of the above. Why? The fascia, which is generally not involved, okay, not involved in droopy tent contracture. In droopy tent contracture, answer will be all of the above. Why? The Cleland ligament, Grayson ligament and spiral band are usually spared. Okay, usually spared. Each of the individual structure is generally not involved. Therefore, the all of the above answer becomes the best answer. Okay. Now question number 21. Question number 22. Pitches with valgus extension overload syndrome are most symptomatic due to valgus extension overload syndrome are most symptomatic due to stress fracture. Okay. Nice. D. Stress fracture. In this case, valgus extension overload syndrome, there is repeated throwing causes microtrauma and stress injury around the elbow. Okay, so why the others options are not fit with this answer? Because the option number A is the loose body, the loose body generally occurs secondarily, not primary. Okay. In valgus extension overload syndrome, which is a primary, but in case of loose body, which is a occurs secondarily due to this. Option B was the chondromalacia patella. Which is a knee pathology, cannot be occurred. And option C was the osteophytes. It may develop later, but not primary pathology. Okay. Next question is question number 23. Which of the following tendon is most commonly ruptured in rheumatoid arthritis? Most common tendon rupture. Option A, abductor pollicis longus. Option B, extensor pollicis brevis. Option C, extensor pollicis longus. Option D, extensor indicis. Okay. Most commonly rupture. In RA. Most commonly tendon rupture in RA is option D, extensor indicis, because due to chronic synovitis causes tendon rupture. Option A was the abductor pollicis brevis. Option A was the abductor pollicis brevis. It's involved in the De Quervain disease. Okay. Option B was the extensor pollicis brevis, which is less commonly rupture. And option C was the extensor pollicis longus, that can rupture but less commonly than extensor indicis in RA. So the question was the most commonly rupture. So most commonly rupture will be, answer will be the extensor indicis. Let's the option C was the extensor pollicis longus, which is less commonly rupture. Okay. Next question is question number 24. That is, in the evaluation of an infant Barlow provocative test result in positive, this is an indication of which? Hip instability, knee instability, shoulder instability, and D, wrist instability. In case of question number 24, positive Barlow test. The correct answer will be option A, hip instability. Right? In case of Barlow test, it attempts to dislocate an unstable hip. Option B was the knee instability. It is not assessed as the Barlow test. Option C was the shoulder instability. Different in case of shoulder instability, different test used. Wrist instability is unrelated to this question. So in this case, answer will be option A, hip instability. Okay. Now question number 25. The primary benefits of CPM after ligament reconstruction. What is the primary benefit of CPM after ligament reconstruction? Option A, pain management. Obviously not. Option B, edema reduction. CPM is not used for the edema reduction. And option C, reduction of adhesion formation. That will be the correct answer. Question number 25. CPM for ligament reconstruction. Answer will be option C, reduction of adhesion formation. Why? Because CPM maintains motion and it prevents adhesion. Pain, the option A was the pain management, that is the secondary benefit, and option B was the edema reduction, is somehow helpful but not the, it is a primary purpose. And option D was the prevention of atrophy. Muscle atrophy prevention requires the active exercise, not the CPM like passive exercise. Okay, prevention of atrophy requires the active exercise, not CPM like it is a passive movement. Okay, so we'll going to the next question, that is question number 26. The etiology of periarthritis shoulder. What is the main etiology? Okay, option A, degenerative cartilage in glenoid cavity. Option B, infection of shoulder joint. Option C, fracture of surgical neck of humerus. And option D, idiopathic. Question number 26, that is the etiology of periarthritis shoulder. Okay, answer will be the option D, idiopathic cause. Because why? In most frozen shoulder cases, frozen shoulder or periarthritis shoulder, both are the same. Frozen shoulder cases, there is no definite cause. Okay, and degenerative cartilage in glenoid cavity, it is more related to option A, it is more related to OA. Okay, and the infection, it is not the common cause. And option D, C was a fracture of surgical neck, that is not the answer because it can predisposes but not the usual etiology. Due to this, there may be fracture of the surgical neck of the humerus or the predisposing factor, but not the etiological factor. Etiology is the idiopathic. That answer will be the idiopathic. So next is question number 27, that is arp palsy is due to injury of. Arp palsy is due to injury of. Option A, head involving premotor area. B, pelvis involving lumbosacral plexus. Option C, thorax involving diaphragm. Option D, upper root of brachial plexus involving C5 and C6. The correct answer for arp palsy in the upper root of the brachial plexus involving C5, C6. So answer will be option D, upper trunk lesion. Now answer will be the C5, C6 roots. So that is the upper trunk lesion. In case of premotor area, option A, premotor area is the UMN sign. UMN sign. Okay. Lumbosacral plexus, that is affects the lower limb. And option C was the thorax involved in diaphragm, that is the phrenic nerve involvement. Okay, so the answer will be the option D. Now question number 28. The following topical antibiotic agent is used in treatment of burn wound. Topical antibiotic. What is the topical antibiotic? That is the option C, silver sulfadiazine. Okay, it is a broad spectrum. 28. Topical antibiotic in burn, that is the silver sulfadiazine, which is a broad spectrum antimicrobial cream, which is used for, and option A was the potassium permanganate, that is antiseptic. It is antiseptic. Okay, and the bentovit is the steroid cream. It is the steroid cream. And another is the acetyl salicylate, that is the analgesic. Okay, so next question 29. A man slipped while walking, developed swelling immediately in the knee joint. Structure most probably injured. Man slipped while walking, developed swelling immediately in the knee joint. Structure most commonly or probably involved will be the anterior cruciate ligament. ACL. Why? Because ACL tear causes swelling and rapid hemarthrosis. Okay. Medial meniscus, the swelling usually delayed. In case of medial meniscus, the swelling is usually delayed, but here it is immediately. So this will be the correct answer. In case of lateral meniscus, similar, delayed. And in case of collateral ligament, usually there will be no hemarthrosis. Okay, so the correct answer will be the option A, that is anterior cruciate ligament. So for today's, this will be the MCQ classes. Will join in the next episode for the